In today's video, we will be discussing aminophylline and its actions, uses, and how it affects the body. So, aminophylline is a bronchodilator that belongs to a group of compounds known as xanthine derivatives. It is a combination of theophylline and ethylenediamine in the ratio 2:1. Theophylline was first discovered by Albert Kossel in 1888 when he extracted it from the tea leaves. Further on, in 1910, Gruter combined theophylline with ethylenediamine to increase its water solubility. If we take a look at the chemical structure of aminophylline, we observe that it is a combination of two molecules, theophylline as well as ethylenediamine. Now, the question arises that why was theophylline combined with ethylenediamine? The reason being that we now know is that theophylline has low solubility and is not well absorbed orally, whereas the theophylline ethylenediamine combination increases the solubility of the formulation and thus is better absorbed. If we look at some of the properties of aminophylline, we can see that it has better water solubility as compared to theophylline. It is also insoluble in alcohol and ether, and on exposure to air, it liberates the theophylline and absorbs carbon dioxide. Now, coming to the actions of aminophylline, that is, the effects it has on the human body. First of all, we can see that it increases bronchial smooth muscle relaxation and also increases the blood pressure due to an increase in vascular resistance. It also increases the heart rate, which may result in tachycardia, and on the other hand, we see that it increases the renal blood flow, which may lead to diuresis. It also acts as a central nervous system stimulant and shows minimum anti inflammatory activity. As a result of its bronchodilatory or vasodilatory effect, it is therapeutically used in the treatment of COPD, which stands for chronic obstructive pulmonary disease. It also is used to treat bronchial asthma, infant apnea, and post-dural puncture headache, as can be seen in the picture. Now, coming to some of the lesser known but equally interesting uses of aminophylline that are not commonly well known. As a topical cream, it may be used as a body fat reducer, while it also may be used to treat acute spinal cord injuries to obviate the use of pacemaker placements. Moving on to its mechanism of action or how it affects the body. Once theophylline molecules, which is the active ingredient of aminophylline, crosses the lipid bilayer of the cell, the theophylline molecule directly affects the phosphodiesterase enzyme. Inhibit the phosphodiesterase enzyme, particularly phosphodiesterase 3 and phosphodiesterase 4, which are located in the heart and lungs. The inhibited phosphodiesterase enzymes prevent the breakdown of cyclic AMP into AMP. This leads to an accumulation or an increase in the level of cyclic AMP or cyclic adenosine monophosphate in the cells. Such elevated cyclic AMP levels activate protein kinase A. This ultimately leads to smooth muscle relaxation or bronchodilation in the lungs, thus relieving the symptoms of asthma or bronchial obstruction. Furthermore, theophylline acts as an antagonist at adenosine receptors located mostly on the mast cells, which results in an increase in cyclic AMP levels that subsequently leads to bronchodilation. Aminophylline interacts with other drugs, diseases, foods, and age. In case of drugs, it interacts with allopurinol, halothane, lithium, mexiletine, ciprofloxacin, as well as beta 2 blockers, along with a plethora of other drugs. When combined with these drugs, it leads to a decreased theophylline clearance and elevated serum aminophylline levels that can lead to toxicity. Aminophylline also interacts with some diseases, which include liver cirrhosis, heart failure, fever, and others, which cause an increase in the mean half life, decreased the drug clearance, and diminished elimination. Aminophylline should be consumed with caution when taken with St. John's wort, alcohol, and grapefruit, among others, as these foods may alter serum concentration levels and may decrease the effectiveness of the given drug. In older individuals, an increase in age may lead to decreased clearance of aminophylline. Most common side effects of aminophylline include lightheadedness, seizures, shakiness, diuresis, which is increased urination, as well as irregular heartbeat. Due to its extensive side effects, aminophylline is contraindicated in people with hypersensitivity reactions to any of its components. People with cardiac disease, epilepsy, renal impairment, and peptic ulcer disease are also advised to take caution while consuming aminophylline. Adverse effects of aminophylline include renal irritation when administered in the form of suppositories, dehydration, gastrointestinal irritation, hypersensitivity reactions such as urticaria, etc. Thus, aminophylline should only be consumed after thorough consultation with a pharmacist or a doctor. Keeping in mind aminophyline's extensive side effects and adverse effects, it was ultimately discontinued due to its low efficacy, harmful side effects, narrow therapeutic range, and very minimal anti inflammatory activity. In contrast, we now have a number of drugs that can be used in place of aminophylline to treat bronchial disorders. These include leukotriene receptor antagonists, leukotriene synthesis inhibitors, salbutamol, and other beta 2 agonists, as well as inhaled corticosteroids. All of these drugs are more effective than aminophylline and have fewer side effects, thus increasing its patient compliance. We hope that this video helped you to learn some interesting facts about aminophylline. Thanks for watching.